Hi, y'all. This is Chapter 12, Eating Disorders. Let's get our slideshow started here so you can see. Here we're going to outline some of the characteristics of eating disorders. We're going to understand the three different types of eating disorders present in the DSM. That includes anorexia nervosa, bulimia nervosa, and binge eating disorder. And we're going to talk a little bit about the treatments for eating disorders. Let's first start with anorexia nervosa. This is a real pursuit of thinness that individuals have that really leads people to starve themselves. And people do starve themselves by eating little or no food for a very long period of time and remain concerned that they need to lose more weight. And often as a result of this weight loss, weight is at a minimum normal for what is the person's age and height. Extreme weight loss can result in amenorrhea in women, where women and girls who have begun menstruating actually stop having menstrual periods. There's two types of anorexia. One is the restricting type, and the second is the binge purge type. Anorexia restricting type is where the individual refuses to eat and or engages in excessive exercise as a way to prevent weight gain. Binge purge type is where individuals engage in binge eating and then purging behaviors. So binge eating is overeating an enormous amount of food in one sitting, and purging is defined as vomiting behaviors. Sometimes there's purging behaviors that are also involve the use of excessive laxatives. Most often we refer to purging as vomiting. Bulimia nervosa, on the other hand, is binge eating that's followed by behaviors designed to prevent weight gain from the binges. Bulimia really can be thought about about uncontrolled eating, and it's often extreme overeating patterns. So binging, again, is uncontrolled eating of large amounts of food. And this binge eating is often followed again by behaviors to prevent weight gain. That can include self-induced vomiting. It can include abuse of laxatives, diuretics, and other purging medications. It can include excessive fasting, going for periods without eating, and it can include excessive exercise. Binge eating disorder, which is the least severe of the three eating disorder diagnoses. It involves recurrent episodes of binge eating, but it does not involve any compulsory behavior. So it would not involve any starvation, and it would not involve any purging. Usually it is defined as eating more rapidly than normal, eating until feeling uncontrollably full, eating large amounts when not physically hungry, eating alone because of embarrassment, feeling disgusted with oneself, depressed, or very guilty after a binge. Often individuals that suffer binge eating disorder are often obese, and depression is very common in these individuals as well. If you take a look at Table 2 on page 336, you'll see the three eating disorders. Of course, here anorexia is broken down into the two different types of anorexic disorders, and then bulimia and binge eating. And you'll see the difference amongst these disorders along certain characteristics. You can compare the differences between the eating disorders along certain characteristics. So, for instance, body weight. We know with the anorexia nervosa disorders, the person is significantly underweight. However, with bulimia, usually the person is of normal weight or they're overweight, and with binge eating disorder, the person is normatively significantly overweight. And you can see, based upon all the different characteristics that eating disorders display, you could see the differences here between all three diagnostic categories. We're going to skip over the slides on obesity, and I want to bring you to understanding the cause of eating disorders. So there's been a number of biological, sociocultural, and psychological factors that have been implicated in the development of eating disorders. Some of the biological factors include there are genetic factors. Like most psychological disorders, eating disorders run in families. When we look at some of the results of the twin studies, there shows an inheritability factor or an inheritability rate amongst twins of 41%, in which both twins are developing the same eating disorders. There's often a few changes in the body that happen that serve as risk factors or areas of interest as they intersect, as they develop into eating disorders. So, for instance, changes in puberty for girls can be a significant risk factor in the development of eating disorders. When one has a dysregulation of any of the neurochemicals, that can be a significant risk factors for the development of these disorders. Lowered functioning of the hypothalamus. That would make sense because the hypothalamus, we know, is involved in the regulation of appetite and hunger. So a dysregulation in that brain structure could lead to irregular patterns of appetite and hunger. We also see abnormalities in several hormonal levels, including some of the neurotransmitter systems of serotonin. Some social, cultural, and biological factors and psychological factors. So some of the social-cultural factors here, some of the social pressures. Sorry, y'all, I'm having a little problem here with the slides. Okay, so some of the social pressures and cultural norms that we see influence the development of eating disorders definitely includes media and its effect on body dissatisfaction. So in several areas and cultures where thin is ideal and promoted and portrayed in the media, we actually see higher rates of eating disorders. We also know that certain groups are at increased rates, or at increased risk rather. So eating disorders is more common in females, and we also know that it can be more common in certain athletes. Certain sports that require athletes to meet weight requirements are at increased risk of eating disorders. Some of the cognitive factors we see that can influence the development are individuals with extreme low self-esteem or those individuals that frequently want to please others. People with eating disorders tend to be very overly concerned with the opinion of others. We also see a thinking style that's very dichotomous in individuals with eating disorders. They display a lot of all or nothing thinking. Often they have extreme difficulty breaking some of these rigid routines that they have, and they also engage in very extreme behaviors where if they eat one cookie, I might as well eat the whole package. That's actually a fixed pattern around this all or nothing thinking that we see frequently with individuals with eating disorders. We want to take a look at some of the other social, cultural, and psychological factors. We know that individuals with eating disorders also have extreme difficulty in regulating their emotions. We see that eating becomes a maladaptive strategy sometimes for dealing with painful emotions. We also see that sometimes the disordered eating patterns that involve binge eating might have actually developed through different dieting techniques, in which a person may have had some success in losing weight, and then that becomes a maladaptive way to manage weight going into the person's future. We also see in a lot of disorders that involve mood, particularly depression, that coping with depression often results sometimes in individuals engaging in overeating patterns. Family dynamics, there's a psychologist by the name of Hilde Bruch, Bruch, that is a pioneer in the study of eating disorders. She really has highlighted the effect family dynamics can have on an individual developing an eating disorder. Often individuals that have difficulty with separation or individuating themselves from one's family can be at increased risk for developing eating disorders. Individuals that have parents who display a great deal of low parental warmth and high parental demands are at increased risk, particularly girls or daughters who do not actually learn a healthy way to accept their own feelings and desires and instead are taught to comply with the demands of others. Often girls who have very intrusive and demanding parents, we see increased rates of the development of eating disorders. Many of the treatments that are available and effective for individuals with eating disorders really do involve psychotherapeutic interventions, and they are along the realm of two primary intervention categories of cognitive behavioral therapy as well as family therapy. And so, as one would expect from cognitive behavioral therapy, the way in which behaviors are adjusted through the use of rewards can be very effective, as well as the way in which the client's cognitive beliefs about their bodies and about their weight is examined and confronted. Obviously, family therapy can be extremely effective, especially if you take into consideration some of those family dynamics that we identified as being potential contributors to the development of eating disorders. And a person with anorexia and her family are actually treated as a unit. And what we mean by that is not only do we look at the individual person's coping strategies of how that person might deal with stress, but we also look at how the other family members either sustain or contribute to the individual's stress or the sustainment of their eating pattern. It's almost very similar to some of the enabling behaviors that families can exhibit when they have a loved one who's struggling with alcohol or drug use. One thing that's not listed here that's of particular importance for the eating disorders is really watching an individual, particularly with anorexia, from a medical perspective. And we know that being profoundly underweight and different times in which individuals may starve themselves or not feed themselves with appropriate nutrition can have significant effects on somebody's physical functioning and their medical health. And at times, individuals with anorexia nervosa have to be placed in the hospital if there are significant medical complications that may accompany their eating patterns or their starvation periods. There are also a few extra treatments that are available, additional treatments that are available for individuals with bulimia, nervosa, and binge eating disorder. You can see at first the cognitive behavioral therapies and the family or interpersonal therapies are just as popular with these two particular eating disorders as with anorexia. You'll also see an additional behavior therapy component here where the client is taught how to monitor her food intake, introducing avoided foods into diet and coping techniques for avoiding binging. There could be rewards and behavior plans put into place for that. And then you'll also see an extra set of supportive, expressive psychodynamic therapy. And really, when you think about the client in terms of their problems and as it relates to their ability to communicate, their ability to assert themselves with others, some progress can be made in that area with some of the supportive, expressive psychodynamic therapies. There are some biological therapies available for eating disorders. Certainly, they have significant short-term benefit. What we do know about the eating disorders is that really most long-term benefits come from a combination of both biological therapies as well as some of the psychological therapies that we reviewed in the 2 slides prior. So that's a little bit of a short overview of the eating disorders, but that gives you a little bit of a sense of the 3 types that are present in DSM and what are some of the common treatments for each.